all men are not the same. Okay, before you get offended, I was not talking about this men. I was talking about the PYT 15 of a final lip series, that is men, multiple endocrine neoplasia. This is a frequently repeated high-yield NEET PG PYQ. A patient with pheochromocytoma also has a family history of thyroid cancer, which additional finding favors men to B over men to A. As usual, before seeing the answer, let's see a bit of concept. Men's syndrome is nothing but they are rare autosomal dominant inherited syndromes characterized by tumors involving multiple endocrine glands. These are of various types. We'll see each one by one. First, we have MEN1 syndrome, which is also known as Werner syndrome. It is due to mutation in the MEN1 gene, which is present in chromosome 11q13, and it is due to protein menin. Remember 3 P's for MEN1 syndrome, which is parathyroid, which is the most common manifestation seen in almost 90% of the patients. It is also the first manifestation. Then we have pituitary tumors, mainly prolactinoma, and sometimes even GH adenoma or ACTH adenoma. Then we have pancreatic neuroendocrine tumors, mainly gastronoma. MEN2A syndrome, which is also known as Sippel syndrome. This is due to red proto-oncogene mutation, which is present in chromosome 10. Similar to MEN1 syndrome, we have parathyroid hyperplasia in MEN2A, but it is less common than MEN1. And along with it, we have medullary thyroid carcinoma, which is almost always present in all the cases of MEN2A syndrome, as well as we have pheochromocytoma. So remember MPP for MEN2A. MEN2B, also known as MEN3 syndrome, is very similar to MEN2A in the gene mutation as well as in the manifestations. It also has medullary thyroid carcinoma and pheochromocytoma, but instead of parathyroid hyperplasia, it has mucosal neuromas as well as Marfanoid habitus. Remember, Marfan syndrome is not present. Marfanoid habitus, like tall, long limbs, arachnodactyly, are only present in MEN2B. Take a quick screenshot of this comparison table. Okay, now the answer is crystal clear. For MEN2B, remember triple MP, which stands for medullary thyroid carcinoma, Marfanoid habitus, mucosal neuromas, and pheochromocytoma. Whereas MEN2A, remember MPP, which stands for medullary thyroid carcinoma, pheochromocytoma, and parathyroid hyperplasia. So the answer to this question is option C, mucosal neuromas.